Hi, guys. Thank you for the introduction. I'm going to talk about, like he mentioned, gender disparities in patients that take Voxelotor and Hydroxyurea. I'll just start with a quick background of my story of my study. So sickle cell disease is a cause of anemia that obviously requires frequent blood transfusions. And the current most common treatments that we know is hydroxyurea and the recently approved medication, Voxelotor. So what it does, it binds to oxygen, makes hemoglobin bind to oxygen more and decreases the polymerization of hemoglobin S. There was a study called the HOPE study that showed that when compared to hydroxyurea, Voxelotor increased the baseline hemoglobin levels in patients with sickle cell disease. So the thought was that it would decrease blood transfusion requirements in these patients. In terms of gender disparities, I looked up researches related to gender disparities itself, and there was only studies referring to the pediatric population. I didn't see any studies comparing these two in adults. There was also a study done in the Nigerian population, but the data is scarce when related to gender disparities in adults that take these medications in the USA. So we conducted a retrospective cohort study to evaluate this, who were either taking Voxelotor, it's also called Oxbryta, it's the same medication, or hydroxyurea outpatient. So methods, the retrospective cohort study identified 8,815 patients across several facilities that have sickle cell disease who are taking this medication outpatient. Those that have CKD stage 4 or 5 or end-stage renal, who are pregnant, had major surgery, or normal baseline hemoglobin levels, elevated liver enzymes were excluded from the sample. We ended up with a sample of 6,240 patients. The reason is because these are some of the contraindications to not take the medication and can affect the outcomes of our research. Then we stratified them into two groups based on the treatment they were on. A group that was on Voxelotor, which was 243 patients, and then a group that was taking hydroxyurea, which was 5,961 patients. And then we assessed characteristics such as age, sex, race, the smoking status, and other events during the hospitalization. The primary outcome was to see if there was any disparities in the blood transfusion requirements on these patients, depending on the medication that they were on. And we used the seroinflated Poisson regression to determine the quantity and prediction of blood transfusions required according to the characteristics. So of the 6,240 patients that were on hydroxyurea, the mean was about 31.2 were female, and 41.89 were male. 94.63 were African Americans, because this disease affects mostly African Americans, and then 5.37% were non-African Americans. So the result was that sex was significantly associated with the log count of transfusions when we controlled for other variables. The p-value was 0.001. And also being female increased the expected number of blood transfusions by a factor of 0.879. So in other words, being female increased the expected number of transfusions by a factor of like 1.138, irrespective of the medication that they were taking for their sickle cell disease. So being on Voxelotor, even though it increases the baseline hemoglobin levels, the number of transfusions were about the same, regardless of the medication. So our conclusion was that being female increases the number of transfusion when compared to the male sex, irrespective of the med group, but we believe that probably contributing factor is just a heavy menstrual bleeding during men's season, worsening anemia, and just they probably might have lower baseline hemoglobin levels because of this, and hematocrit levels as well. However, our study did have a relatively small sample size on the patients that were taking the Voxelotor, so there might be other confounders in this research. So further research is needed to assess this. And that would be it for my presentation. Do you guys have any questions?
Thank you so much, Virginia. We do have one question, and that's going to be, how did this research topic arise? What specifically sparked your interest?
So I want to specialize in hematology and oncology, specifically hematology. And when I was doing nights, we had so many sickle cell patients. And I was noticing just by the amount of patients that I was having that the patients that were female required way more transfusions than males. But I didn't know if this was kind of just on my head or if this was an actual thing. So that's why I wanted to investigate it.